It's completely normal to feel scared when you receive a cancer diagnosis. You might feel like your life is out of control and that everything you do suddenly revolves around your disease. But surviving cancer is about more than getting rid of the disease. It's about finishing treatment cancer-free, with your quality of life, goals, and dreams intact. It's a bump in the road of life, not a dead end. Your cancer survivorship care begins now with your diagnosis. That's why it's important to talk to your doctor, nurses, and nurse navigator about your day-to-day activities, as well as your life goals. So your treatment is designed to get rid of the cancer while preserving your quality of life and remain focused on your future. For instance, if you are young and want to start a family someday, your doctor can refer you to a fertility preservation specialist if treatment might affect your ability to have children in the future. If your passion is to become a concert pianist, your doctor can avoid certain treatment therapies that cause numbness, pain, and tingling of the fingers and toes. Your treatment team can work with you to reduce side effects of the medication so cancer doesn't derail your dreams. Also, many people need to work to keep their income and health insurance intact. This usually can be accomplished while still receiving the appropriate treatment you need. It just requires planning. At the beginning, it may seem like cancer will take over your life, but you should only give cancer the time it requires to get rid of it. This will help you reduce your stress, which is a big factor in immune function. Find out how long your treatment will last and schedule it to minimize disruption of your daily life. When the surgeries, chemotherapy, and radiation treatment are over, you might be left with mixed emotions. You want to celebrate being cancer-free, but you're hesitant for fear of jinxing yourself. You're not alone in these thoughts. This is a life-altering experience. You've faced your mortality, and now you're faced with the transition back to community providers and taking charge of your own health. Due to the shortage of oncologists, your community providers will take over your care so that newly diagnosed patients can have access to your oncology team. Before the transition, ask your oncology team for a copy of your treatment summary and survivorship care plan. It's really your survivorship life plan. They'll give you a roadmap for planning your ongoing care with your general practitioner. Ask questions like, what monitoring do you need? How often and why? What is your risk of recurrence? And when does the risk go down? And what should you expect from your treatment summary and survivorship plan? There are many different types and stages of cancer that come with many different risks of recurrence. Having this information empowers you to make informed decisions and monitor your health going forward. Depending on the kind of cancer you had and the stage of the disease, along with the treatments received, your doctors will have determined what types of monitoring and screening are needed. Don't be surprised if you're not getting lots of scans and tests done going forward. In many cases, such tests are no longer necessary or recommended. Physical symptoms are commonly a better way to determine if something warrants being pursued further. And don't assume every ache and pain is related to the cancer. Generally, if a symptom lasts longer than 3 weeks without a known cause, you should check with your general practitioner. Remember that list of your life goals you shared with your treatment team? This is a great time to revisit that list and make sure you're still on track. Is there anything that you'd like to add after this life-changing experience? Maybe you want to work less so you can spend more time with your grandchildren. Maybe you've got a renewed desire to finish your college degree. Maybe you'd like to try a new career. Your survivorship life plan should include these goals, as well as lifestyle behaviors that will help you live your best life moving forward. Although your treatment is done, you might still be dealing with the side effects, fear of recurrence, or anxiety as a result of the disease. Connecting with other cancer survivors through a survivor volunteer mentorship program can be enormously beneficial in helping you through this transition. You have been given the gift of life. What you do with this gift is up to you.